What exactly is WLA meaning?
Thank you for that question.
Yeah.
So WHO has a process of looking at the capacity of regulatory authorities. So this is in the framework of what we call the WHO listed authority. So it's a process of assessing the regulatory capacity in terms of specific functions.
That we reach this WHO listed authority is not easy. That's a lot of people sacrifice the time, sacrifice the feeling, sacrifice everything. Meaning we really appreciate from all of our people, our employees, our team in BPOM is really working very hard. Sometimes they don't back to home, just stay here to make sure every sick.
About the vaccine industry, in simple terms, what are the most tangible benefits?
So that's a very good aspect of this process. So already, as mentioned by Prof. Tarun, I want to reiterate that point. The regulatory process and the regulatory environment are enablers of the market, are the enablers of the industry. What do I mean by that?
Halo sahabat BPOM, welcome back. Senang banget bisa kembali menyapa teman-teman di podcast KataBPOM. Dan seperti biasa, saya Ragil.
Dan saya Henrika. Hari ini kita balik lagi dengan topik yang cukup spesial ya Ragil, karena
betul.
berkaitan dengan kabar baik untuk Indonesia di panggung internasional.
Nah, sebelum kita ke main topiknya nih, saya kasih pantun sedikit dulu ya Henrika ya.
Cakep.
Belum. Kita ulangin ya.
Oke.
Pergi ke Jenewa membawa amanah.
Cakep.
Singgah sebentar di panggung dunia.
Mantap.
Bukan sekadar perjalanan atau kisah,
Asik.
tapi pengakuan sistem pengawasan BPOM di Indonesia.
Yeay, keren banget pantunnya. Tapi pantun ini bukan cuma pembuka ya Ragil
Betul.
ya. Karena Jenewa itu identik dengan banyak keputusan penting di tingkat global. Dan di penghujung 2025 kemarin, dari Jenewa juga datang pengakuan dari dunia untuk Indonesia lewat status WHO Listed Authority atau WLA.
Dan di episode perdana 2026 ini juga spesial sahabat BPOM karena kita kedatangan tamu langsung dari WHO. Jadi mungkin nanti obrolan kita bakal lanjut dalam bahasa Inggris nih supaya diskusinya bisa langsung nyambung dengan narasumber kita. Nah Henrika, sebelum kita ke diskusi dengan narasumber, Henrika sudah sering dengar belum terkait WLA atau WHO Listed Authority? Udah familiar belum sih?
Udah sering denger nggak sih sahabat BPOM ya
Iya.
tentang WLA ini di sosial media BPOM? Tapi bikin pusing nggak sih karena terlalu formal gitu.
Betul.
WHO Listed Authority. Sebenarnya relate nggak ya sama kita, masyarakat, dan juga industri vaksin di Indonesia?
Bener banget, saya juga kiranya gitu Henrika. Tapi pas baca dikit-dikit, mulai di scroll sosial media nih, ternyata WLA itu penting banget. Karena ini adalah pengakuan dari WHO buat Badan Regulator Obat Nasional. Yang artinya reputasi dan kredibilitas Indonesia meningkat. Bukan cuma di level nasional loh, sampai dengan kancah internasional.
Wih, keren banget ya Ragilnya. Nah, akhirnya daripada kita kelamaan ngobrol berdua, langsung aja kita sambut narasumber kita hari ini.
Oke. Our speakers today have been directly involved in Indonesia's journey toward WLA. Without further ado, please welcome Profesor Taruna Ikrar, Chairperson of Badan POM.
Hi.
Yeah, thank you so
Welcome,
much for
Prof.
having here. Iya.
And we're also joined by Dr. Roderick Salenga, Team Lead for Health System at WHO Indonesia. Welcome, Dr. Eric.
Thank you so much.
It's good to having you with us.
Thank you so much.
Yeah, let me ask the first question, Dr. Eric. We have mentioned WLA quite a few times until right now. But for our audience, sahabat BPOM, what exactly is WLA meaning?
Thank you for that question.
Yeah.
So WHO has a process of looking at the capacity of regulatory authorities. So this is in the framework of what we call the WHO listed authority. So it's a process of assessing the regulatory capacity in terms of specific functions. So if we are able to see that the systems are mature, they are scientifically robust, then we will be able to give that assessment. It also talks about the reliability, and the ability of the system to really deliver its impact in terms of ensuring safety and quality of products in the country.
Okay. And then Prof. Tarunya, why WLA is matter not only for BPOM as the institution but also for Indonesia as a country, Prof?
Thank you for the question. Of course, the WHO listed authority is matter for us, very important for us, because it has many impact for our country. Just for example, as one of the middle income country, our purpose one day can be high income country. That's why our government already decided to be, the trap is about 8% increasing annually. It's meaning we want to be high income country, but currently we're still a middle income country. And we are just the first middle income country get the WHO listed authority.
Wow.
It's meaning we are the frontier. Of course, because of that, we feeling proud. And other thing, the WHO listed authority also has more impact to the global, and of course will have impact to our country as well. For example, we know that we have in the world right now, worldwide, we have it is about 196 countries. And WHO listed authority just about 30 countries. 30 countries means more than 30 countries, but less than 40 countries. And WHO listed authority, it's meaning our reliance, our system, our scientific base approval, because WHO listed authority, at least there are 9 criteria to be assessed. First is we say the regulation, our regulatory system of Indonesia. The second thing belonging to registration process. The third is vigilant. Number 4 is belonging to laboratory tests, clinical trial oversight, as well about the most important thing also about the licensing. And so many things this is very important for us. When we get it this one, we saw that all of our system or regulatory, from research and development until the final one, for example, law enforcement, or our system is already accepted in the global standard. It's meaning we approve it, that we are in the highest level of maturity. Like we know we have it for maturity level 1, 2, 3, and 4. We are already for maturity, and the last one we already listed in WHO listed authority. And more will be impact in the economy, meaning if our standard already accepted, meaning all of our product from Indonesia we export, we can send for worldwide, around the world. It's meaning the market side will increase because the demand is increased. That will impact also about vaccine and drug in Indonesia can reduce the price because our country can produce more. Of course, if we produce more, the price will reduce. And the last one is belonging to reliance and reference. Means worldwide will reference us. And also to get going through to the procedure to register our product in other country will become reliant. It's meaning our product can be accepted in other country, not only in Indonesia, not only in our neighbor like the Asian country, but our product from Indonesia can accept it in the highest income country, including United States, in Europe, UK, Japan, etc. That all of that means WHO listed authority for us is really matter.
Wow, so comprehensive answer that Professor Taruna gives. So this is not just a reward, or maybe we can say that it's not just a certificate. It's really a recognition, Professor, that our regulatory system has reached a certain level of maturity and trust. Is that right, Professor?
It's correct, absolutely.
Yeah. Okay.
So, yeah, Ragil, so sahabat BPOM, WLA is not just a terms, not just a label, because it's a reflection of how strong, consistent, and reliable a regulatory system truly is.
Exactly.
Now I'm curious, Dr. Eric. In simple terms, what exactly does WHO look at when assessing a country for WLA?
So thank you for that very good question. So as already mentioned by Professor Taruna, we're looking at specific regulatory functions. These regulatory functions are very critical in order for us to ensure that the products that are put out in the market are safe and of high quality. So in the WHO listed authority assessment, we're looking at specific functions. For example, marketing authorization, or maybe inspection, or maybe licensing. In the case of vaccine, we're also looking at lot release. And then we also have laboratory testing. So what we are looking at is not just whether these processes are documented properly on paper, but more importantly, if they are lived out practically, meaning to say they are performed at their best level on a day-to-day basis. So it's like making sure that the quality processes, the quality documentation, the quality workforce within the organization, it's a reality on a day-to-day basis. So what does that mean then? If this is consistently being carried out, we make sure that the products that are regulated under BPOM, for example, every day that you put it out, we are quite sure, we are very assured that this is a product that has gone through a thorough assessment. And so for us in WHO, just to reiterate, it's not just about making sure that they are on paper, but these are things that are practically done. Because it's one thing to have things well organized, right? It's a good documentation. But what we want is that these are actually lived out on a practical basis.
Yeah, so it's becoming clear, Henrika, that if I could say, WHO looks at so many different aspects, many different parameters very carefully and very thoroughly. Okay, I'm also curious, Dr. Eric, from WHO own perspective, why has the WLA framework become so important at the global level?
Thank you. Again, another important question. So we understand that it's important that there should be a reliable, evidence-based, and very functional system to regulate products. Because every day, like I'm sure anyone in the population out there will have to have used a product, right? So it's an everyday reality, which means to say that it's important for us to make sure that there are systems and institutions that are in place and enforced so that we are protected. So the WLA mechanism is a way of ensuring public health, right? It's important for us to make sure that we are able to secure our people, because when we are able to carry out functions very carefully and then they are scientifically robust, then we are having this peace of mind that the product is appropriate, it's suitable for us, right? So in the broader context, it is also supporting the agenda of regulatory system strengthening and reliance. What does that mean? If, for example, already mentioned by Professor Taruna, it gives us a sense of when we put out a product that is regulated by a WLA authority, like in the case of BPOM, there's a high level of confidence, right? That, this product is actually regulated, tested, and quality assured by an institution that is fully capable. So therefore, it gives us patient or consumer confidence, right? It also supports the agenda of regulatory reliance because we understand that not all countries have functional regulatory systems, especially those that are in low and middle income country setting, which means to say they can now refer to the decisions made by BPOM. That's what we talk about in terms of regulatory reliance and reference already mentioned by Professor Taruna, which means to say there might be an opportunity for them to relook at their processes so that they may not need to duplicate efforts. Like the decisions carried out by WLA authorities can easily be referred to because somebody reliable, somebody that is scientifically driven and robust had already made that kind of assessment. So it then, in the end, supports the agenda of access to products because it facilitates market entry, it facilitates more efficient distribution of the products, and then ultimately it drives the agenda of global supply, right? It also makes us ensure that the products will be available when we need them. Because it's not just a matter of making products available, right? We want to make sure that the products out there are safe. And effective. So we have to have reliable regulatory authorities.
Okay, so after hearing the Professor Taruna and also Dr. Eric explanation regarding this WLA, so it really feels like WLA is the result of a long and serious system transformation. Then, so it would be fair, Prof. Taruna. WLA is almost like fitness test for a regulatory system, a way to see if it's truly strong, resilient, and ready to be trusted by the world.
Yeah. This is important statement because we can understand how important the WHO listed authority. Yeah, just like 5-star level, we know that by maturing, like the Dr. Eric tell us that as the Indonesian FDA is a regulatory, we want to make sure and protect the people, prevents the people for something can harm them. Just for example, our actually capacity to decide is to make sure all of the product sell in the community should be safety. Second thing should be also good efficacy or effectiveness. And the last one should be good quality, not under quality. It's meaning for all of this, if the authority has or regulatory give a stamp for that product, that can enhance the trust from the people. They can feel more safe to use that product. That's why as regulatory, as a government body, we need to make sure all of product going through to the people or community should be safety, efficacy, and effectiveness and good quality. For that reason, of course, they are the body to do that one. The name is BPOM in Indonesia, and Indonesia currently already assessing, achieved WHO listed authority with the start from, we say from a registration process, we say the marketing authorization. Also, we already understand our regulatory already approved, our system already approved too, that we are one of the best in in the world.
Yeah. So you mentioned earlier that the benefits of WLA is the product itself. But now sahabat BPOM and I obviously are wondering, with this WLA status, does Badan POM or Indonesia as the whole country now has a more strategic position or maybe a stronger role you mentioned earlier in the international level, Prof?
Yeah, of course, because by we get it, the WHO listed authority, meaning we already saw up that our system, our reliant system, already saw that we get the high standard in the global standard. We get it means that can increase our reputation, and because we are now currently is reference. It's meaning all of our standard output from BPOM can be also reliance and also become reference to other countries.
Yeah.
I mean that is very strategic.
Since Indonesia is the first middle income countries.
Let's turn to Dr. Eric. From WHO's perspective, how does strengthening a regulatory authority like BPOM contribute to a stronger and safer global health system?
Thank you. So maybe I can initially say that this success, this important milestone of BPOM is a result of commitment, long-standing commitment. And again, we specifically thank the leadership of Prof. Taruna because this is a result of hard work, not just of a one-day hard work. It's spanning many years, which means to say the level of commitment is now translated into global recognition that your systems, your processes, the people behind these processes are truly global in terms of capacity. Now, going back to the question, for us in WHO, we looked at this process and this milestone of Indonesia as a potent contributor to the overall agenda of regulatory system strengthening. We know that there are a lot of challenges because our global needs keep on evolving, health technologies keep evolving, right? And then the disease burdens, the epidemiological trends, they keep on changing. And so it means to say we have to keep up with that evolution, with that evolving landscape. And with that evolution, you see that there are a lot of demands in terms of how we're able to regulate, how we're able to make sure, as mentioned by Prof. Taruna, safety, efficacy, and quality. So every time that a national regulatory authority submits itself to WLA process, we are very encouraged because it means to say there is a strong commitment in terms of learning, how things are being done. There's already an extensive way of expressing the commitment to learn, right? Number two, it's already an express commitment to keep on improving in terms of how the times are expecting us to deliver. And so when BPOM or any other national regulatory authority achieves a WLA status, we are highly encouraged because it means to say that we have another potent actor, a very important stakeholder and partner that can deliver the agenda of safety, efficacy, and quality. And I wanted to go back to the issue of how strategic it is for Indonesia. Indonesia is the fourth largest country in the world. So domestically, just nationally, the agenda of WLA, it's very important because it means to say we have a very trusted, very, very functional, very mature regulator in BPOM. So we are assured in terms of the quality of the products. And then Indonesia, in the region, in the broader ASEAN region, for example, we know the leadership potential and the leadership role of the country, the roles that it plays. And now that we have moved, Indonesia has moved to the Western Pacific region. This is even a larger region now. We see that this is a showcase of the direct influence in terms of many things. It's not just about the access of the products or the quality of the products, because we know that if we make things available to our patients and communities, we will have direct influence on how we will manage different diseases and medical conditions.
Yes.
So this is not just about the agenda of access to medicines and vaccines. This is also access of addressing public health priorities, diseases, medical conditions, right? And also towards wellness and the well-being of the general community. So for us, it's the whole stretch, right? From products to people to communities. WLA status of Indonesia is very important for us because this is a showcase of commitment to the country and to the global community.
Yeah. From the people, products, community, and also the country. But
Yes.
how about the vaccine industry? In simple terms, what are the most tangible benefits?
So that's a very good aspect of this process. So already, as mentioned by Prof. Taruna, I want to reiterate that point. The regulatory process and the regulatory environment are enablers of the market, are the enablers of the industry. What do I mean by that? If I am a product developer, definitely my goal is for my product to be made available, right? Somebody has to use it. And for us in the industry, for example, in the research and development industry, in the product industry, for us to reach the market, we have to have an enabler. And in this case, BPOM is the enabler. We would want to make sure that the systems are responsive, reliable, scientifically robust, so that when the product is ready, it's subjected to the assessment, and then BPOM will test. BPOM will vouch if it's quality, if it's safe, if it's effective. So that when they put the stamp of approval, the people are confident this product is fit for use. So it addresses the issue of access and need. And then at the same time, already mentioned earlier, we're able to reach a bigger market. Because now, we are seeing that AA status is an indication of performance, right? That this is something that can be relied on. It's not just national quality level, it's global quality level. So if our WLA status has been achieved by our regulator, it also means to say that anything that it approves, it really is worth circulating in the market. So you're actually helping the industry to enter additional markets by virtue of the registration, for example. So it helps them definitely to access a greater market.
So BPOM helps industry to achieve
As well,
the standards.
yes. Exactly.
Yeah, regulatory reliance. And how about Professor Taruna? What is the tangible benefit for pharma company in Indonesia, especially for vaccine? Because Indonesia has achieved this WLA, Prof.
Very interesting question. Like I mentioned before, that actually the impact of the WHO listed authority not only belonging to the trustable, but also most important also has a lot of impact, include the economic impact, include how to serve the people, and also how the product can going through to have access to other country. It's meaning a lot of benefit. And like your mention and your question belonging to specific about our pharmaceutical industry, of course will be have much impact. Just for example, like Dr. Eric already mentioned that our standard already not national level standard, but our standard is globally standard. It's meaning if any product already get approval from Indonesia or from BPOM, it's meaning that is already product is the same standard in the globally. It's meaning this product can use it, can have access to other country, not only in Indonesia, but other country. It's meaning, and we know that WHO listed authority is the highest standard level of maturity, the highest standard level of trustable, and the highest standard level of about the confidence belonging to what? Belonging to the safety, belonging to the quality, and belonging to efficacy. It's meaning, if we already, why that the high standard? It's meaning because the process or functional regulatory start from registration process, even from a clinical trial in research and development and marketing authorization, also a distribution process include our export-import belonging to the reliant and vigilant our system and oversight of clinical trial. Its meaning is really people can believe our product is a good. If something like that, of course, can be have impact to vaccine and medicine produced by our industry in Indonesia. Just for example, I believe, for example, some our industry like biopharma, biotis, or etana, that is that big farm is produce the vaccine. All of the vaccine produced from these three of company can get recommendation to sell to other country from WHO. It's meaning many our vaccine already can get that one. I believe we already get information that one of our vaccine produced already can sell more than 150 countries. And with the doses is 1.2 billion doses. It's meaning can impact billion people around the world because WHO listed authority that of course is a good impact, a good news for the all of our industry, especially pharmaceutical industry. It's meaning their product can sell, can send, can export to many countries. And from our side is a government. We don't think just economical and benefit, but we want to show that our product in Indonesia can serve, can help other country, include how to take care and from prevention until take care, until care, until cure of diseases around the world. That we want that one. That is also can good impact again to our people.
Yeah.
I mean, the most important for us is how our institution like Indonesian FDA or BPOM can help more people. Not only for our people in Indonesia, but we want to also serve our globally.
Or global,
That's the important one, Enrique.
Yes, this is really about Indonesia's long-term reputation and credibility in the global health community. So, Dr. Eric, looking ahead, how long does WLA status remain valid? And from WHO's point of view, why is it so important for a country like Indonesia to maintain this status, not just achieve it once?
Thank you. Indonesia's commitment to quality has always been there. So just reflecting on the history of the work on the WLA, back in 2012, there was assessment, and then there was a designation of the maturity level 3 during 2019 assessment, and then we've done a lot of work until we've reached this milestone in 2026. No? So what I'm trying to drive at is that it is in the DNA of BPOM to make sure that things are improving continuously. And that is what we truly appreciate about BPOM, the openness to continuously improve. Which means to say that for the WLA, it's not actually the destination, that one-point destination. It's really an ongoing journey towards quality improvement. For example, in our current WLA status, we are only just focusing on vaccines for now. What we are hoping is that later on we can expand to medicines and maybe later on to blood and blood products, right? Which means to say that there's a lot of room for further expansion in terms of your influence, in terms of your capacity, in terms of the opportunities that can come along our way. Why is it important for BPOM to maintain this? Well, there are two levels of answer to this. Number one, we have the national commitment, right? BPOM is a national institution. Our commitment is to the Indonesian people. Our mandate is to make sure that the product used by our people are always safe, effective, and of high quality. That's our number one goal. And number two, because of the WLA status, because of our maturity in terms of our regulatory functions, we are also able to support other countries. You are a vaccine producer, you are a vaccine exporter. Many countries do not have that capacity. So that means to say they rely on countries that have those functions. And Indonesia is a strategic player for this. But of course, it's not just about them producing or them exporting. They want to make sure that they receive products that are safe and quality. So it is a commitment also to the global community. So if that is the case, I think this is not going to be really a one-time thing. It's going to be
It's
like
not the end point.
It's not like ending in this point. No, it's always a commitment to continue and to keep on improving. So what we're hoping is that there will be sustainability in terms of the processes and in further improvement in terms of the way you're doing things in BPOM. And we are confident that BPOM will be able to do it.
Yeah. Year by year, continuous improvement is the key important one. Professor, what does Badan POM need based on the Dr. Eric explanation? Badan POM need to do to ensure that WLA is not just a temporary recognition but a long-term national commitment.
You are right. I mean, like the Dr. Eric mentioned, is meaning WHO listed authority is not just the final step or purpose or goal. This is a journey. We want to keep it this status and we improve it from single step to more step influence to our globally because we needed that status. Because of that, sustainable of this position is very important. To make this sustainable disposition, of course, we need to maintain every single we achieve it, we take care like we promise. So, for example, we promise to keep it, make sure vigilant, belonging to any product, but currently is belonging to the vaccine. Of course, we will keep it that promise, and next we will improve to another product, for example, to the drug, even one day to medical device or maybe for blood product. It's meaning we are on a journey. We are not the last step of this position. Another thing also, like our commitment, the main purpose not only to get the status, but actually we want to make sure all of the community, all of the people get and consume the right and safety product, even vaccine or drug or medicine means because we are like is very principle belonging to safeguard, protect care all of the people. We are also like guarantor. But that's why any product should be, we maximize by our regulatory system to make sure is function well. Function well for what? To make sure all of the product we approval is safety, efficacy, and good quality. Another thing also, of course, we want to strengthening our impact to neighbor and even the globally. So we are happy to do collaboration to other country in regulatory, even to other sector, for example, industry and community. That's why inside my leadership, we develop the concept like ABG concept, academia, business, and government collaboration. that is a concept very important because we believe by do collaboration, industry, in Indonesia we already have it is 272 industry for the medical industry, and also for the vaccine industry we have it 3, and we want that is more developed. They take care themselves and we assist them to make that industry become the high maturity also. Another thing also for us, we collaborate with the 100 university, not only university, the best university in Indonesia, but around the world, like the Harvard, Tsinghua, and other country, Stanford. We do that one because we want actually academia influence, because we understand as academia, I know from inside the campus a lot of ethic, a lot of experience that idealism come. And as a government, of course, we are on behalf of the people, on behalf of the country. We need to make sure our reputation can still going well in a good impact to not only for the community, but also impact for other country in the globally. It's meaning you are right. WHO listed authority or WLA is not the ending.
The ending.
This is
Our
long
long-term
journey or
commitment.
term. We will keep it that sustaining.
Yeah, agree with you on that.
Okay, so from Prof. Taruna explanation,
Yeah.
next BPOM want to achieve for not only vaccine but also medicine, blood product, Prof.
Yes.
Yeah, so it's interesting, sahabat BPOM, because listening all of this make us proud. It really feels like Indonesia has taken a step forward.
There.
And the impact is something that we can actually feel in our everyday lives.
Exactly. This is not just about a prestigious title, yeah. It's about real, meaningful benefits, better product safety, stronger trust, and faster, more reliable access for our citizens.
Okay, let's continue.
Yeah, okay.
Sahabat BPOM, earlier we talked about what WLA is and the major benefit it brings. But what often remains unseen is the journey behind it. Many people see it's a single moment like BPOM achieved WLA.
Yeah.
But in reality, behind that moment lies a long journey with many carefully defined stages. So, Prof. Taruna, if we look back at the moment, what the special moment that you remember in this journey through a WLA actually became?
You know that we reach this WHO listed authority is not easy. That's a lot of people sacrifice. Sacrifice the time, sacrifice the feeling, sacrifice everything to get this position. And long journey as well, like we mentioned before. We started from 2012, just start to understand how to be assessed to be WHO listed authority. And from leader by leader, I just I continue for their job before. And I do progressive because I make sure one is my target in this year to get it that. And we are happy because we get it. That we get it this WHO listed authority, like I mentioned before, not work from one person. It is work from our team, our group. Meaning we really appreciate from all of our people, our employee, our team in BPOM is really working very hard. Sometimes they don't back to home, just stay here to make sure every single thing they can approval, they can show us. Another thing also, because this assessment is really fair, it's meaning we don't know what the assessor will asking us. When that time we feel it, we are afraid. Maybe we get it or not because we don't know. We don't prepare it that. But the assessor want to know exactly what going on our regulatory system in Indonesia and how the functional coming. And finally, this we get it by, is really very fair. And other thing also, we are happy because we get a lot of also like help meaning we get the assistant. People assist us, include from WHO, lead in Indonesia, in Asia, so that they guide us what, for example, we can do and what kind point. Another thing, a lot of people from the high level till the techniques level, they are also contribute for us. Because of that, I appreciate all of them. We appreciate their work. We get it this one because we working together, because all of your sacrifice. Thank you.
Wow. The long journey, a lot of sacrifice. And after that point, the process become much more technical and substantial in the 9 aspect. And it was no longer just about intention, but about proving the entire system in a comprehensive and transparent way. Yeah.
In transparent way.
In transparent way also, as well. So, Dr. Eric, from WHO perspective, how crucial are the stages in assessing a country's readiness to become a WLA?
Thank you so much. So the WLA process is really step by step. And we are from the WHO country office in Indonesia. We are a witness to the many days and nights of hard work of BPOM staff. So again, just to appreciate the hard work of the women and men of BPOM. So the process is step by step. There has been a lot of meetings and discussions. As you know, our team from headquarters facilitated the team that would inspect. We in fact engage even external experts to support the process. And as already mentioned by Prof. Taruna, this is really a very objective and fair process. Nothing is like told or mentioned earlier so that you can prepare. Everything is really done in a professional, transparent manner. So the assessment is also coupled with performance assessments or performance evaluation that involve visits. We have colleagues coming from the headquarters and even regional offices actually from Southeast Asia and Western Pacific to do the ocular, to do the visits, to inspect and to see how it's done. Because as earlier mentioned to you, that this is not just about seeing what's on the paper, because sometimes regulatory work means good documentation, right? But the real good work must be seen in how things are done at a practical level, how you implement. So the performance evaluations were done, and then there was a lot of back and forth in terms of feedback. And we want to again appreciate BPOM because in all of those sessions, we felt that BPOM was very open. There was an atmosphere of openness that is driven by willingness to improve. Whatever we see that is an area for improvement, the BPOM leadership and staff, they take note of that and they act on it. That's the most important thing. It's not just a matter of receiving the information. There are many things that you are putting in place to make sure that they are addressed. So in the end, when we were able to put together all the findings, there's a process for feedback, right? Do you agree? Do you not agree? And even with that process, even that tail end of the process, we see again the commitment of BPOM, identifying the opportunity for growth, and then also committing extensively to the changes so that you will be able to achieve what you have set for yourselves. I think for BPOM and Indonesia, at this stage, you have achieved that position as a role model for the region. Maybe what we have to set our eyes on is later you will be the best in class, right? Like a valedictorian maybe, right? So that's the emphasis that we want to put on continuous development and improvement.
So there were so many stages that national authority have to require enormous effort, Prof.
Yeah.
Then after going through all of this step, Professor Taruna, what other process that still had to be complete before WLA was finally recognized as meeting the WLA standard?
Yeah.
Like you asking that actually we do a lot of things to get the WHO listed authority, because their WHO standard is very high. That's why a lot of before we get this one, a lot of like the correspondence to they asking us, and we approve, and we give we have it transparent, and finally we get it that. But I believe we get this position is because we are performed well. That make us not only proud, that meaning it is objective, we can get it this. And to move forward in the next level, of course, so many things we need to still do. For example, our team need to make sure specifically belonging to ISO the vigilant or vigilant report still be improved. Another thing I thinking about the clinical trial oversight. We are not satisfied yet. We need improvement. Also that improvement. Another thing more specifically belonging to our vigilant, specific the vigilant report. Until now, because our system ISO us that we get a report just from public health services or from hospital. But actually, belonging to my understanding, belonging to pharmacovigilance, include the vaccine, should be directly also we can get report from the people. That we don't have it yet. That's why I want to improve that the system. And other thing, because we want to move forward to another type of listing authority, I means we from the vaccine we learning, and the next we will thinking about the medicine, include the drug, and the last one about the blood product also we will do. I means a lot of thing we still do. Means we will move forward. Our commitment, we will improvement, we will do our best, and the most important, this is a journey, not the end of our journey, but we need to move and going through to the next situation and the next level.
Still long journey.
And the most important, we want to make sure is this standard is sustainable.
Okay.
Yeah.
Yeah. Still long journey ya, sahabat BPOM. From this story, just listening to the story, we can already feel how much dedication and effort went into achieving WLA. From the story, we can see that a strong regulatory system is built through a long process, great teamwork, and consistent commitment. It is never something that happens overnight, Henrika.
Yeah. So Ragil and sahabat BPOM, WLA is not just about the global recognition. It's about how a system is built, strengthened, and sustained to protect all of us today and in the future.
Yep.
Yeah. I think this is the end of our discussion. Thank you, Prof.
Thank
Taruna,
you so much,
and
Professor
also
Taruna.
Dr. Eri.
Thank you so much.
Yeah.
Thank you as well, Team Lead Health System WHO Indonesia, Dr. Roderi Salengga.
It's a pleasure. Thank you so much for having us here.
Iya.
Sahabat BPOM, pengakuan WLA ini bukan cuma kabar besar buat BPOM, tapi juga kabar membanggakan buat Indonesia.
Karena ini artinya sistem keamanan obat dan vaksin kita diakui dunia. Dan itu pastinya keren banget nih, Henrika.
Keren banget.
Tapi kebanggaan ini nggak cukup cuma dirayakan. Kita jaga bareng-bareng ya. Mulainya dari hal kecil, jadi konsumen yang cerdas, cek izin edar sebelum beli, pastikan belinya di tempat yang resmi. Dan jangan gampang percaya info yang katanya-katanya nih, Henrika. Kalau sahabat BPOM nemu produk yang mencurigakan atau ada obat yang dijual sembarangan, langsung aja lapor ke BPOM lewat pom.go.id atau hala BPOM 1500533.
Karena menjaga kesehatan bangsa itu bukan cuma tugas pemerintah, tapi juga tugas kita semua.
Betul.
Dan ingat ya, kalau mau cari info soal obat dan vaksin, bukan kata orang, bukan kata dia, tapi
Kata BPOM.
Jangan lupa subscribe channel @bpom.official, share episode ini ke teman, keluarga, dan grup WA ibu-ibu juga boleh. Karena semakin banyak yang tahu, makin banyak juga yang terlindungi.
Betul sekali Hendrika, saya Ragil.
Dan saya Hendrika.
Pamit undur diri. Sampai jumpa di episode berikutnya. Tetap sehat, tetap cerdas, dan tetap cinta produk yang aman.
See you.
Sampai jumpa.
Bye-bye. Sampai jumpa.